If I had been smoking for the last 1 year, that is exactly how I will be right now. Right? So you can legally buy a cigarette when you are once you're 21 years old. So if I had been smoking this last year, that is exactly how I will be right now. So if you know me, you know how I can talk for a long period of time without taking much breaks, right? But if I have been smoking, I will have to cough a lot. So since I have your attention, let me explain the ill effects of smoke. How many of you are smoking? So smoking causes 20% of the deaths in the world. 20% of the deaths. Right? Each cigarette is capable of taking 11 minutes of your life. Each cigarette. And nobody stops with one cigarette. Nobody stops with one cigarette. Now there are patients who come into the hospital when we are supposed to take a history. We also need to take we also need to ask about their smoking habits. Okay, so they never say, I smoke one cigarette per week. I smoke 2 cigarettes per month. No, I smoke 20 cigarettes. That's 20 cigarettes per month is no, 20 cigarettes per day. It's called one pack. So 20 cigarettes. Usually in one pack, you have 20 cigarettes. 20 cigarettes a day. Forget about the health effects for now. Money. Smoke one pack a day, I think it's, I don't know the price of a cigarette. If I bought one, I didn't know. I think it's probably, I don't know, 1,000 rupees. I don't know. If, or 600 rupees. Let's just say 600. 600 rupees a day just for smoking. 600 rupees to kill yourself. 600. Now people say time is money. This fellow is spending money to reduce the time he has on earth. So if you take one cigarette a day, can take away 11 minutes of your life. 11 minutes of your life. So if that fellow is taking 20 cigarettes, then how many minutes? 220 minutes of his life. So let's say this is 660 rupees, because I want to easily divide, I'm putting it like, okay, 660 rupees for 20 cigarettes, let's say. So he is not only losing 220 minutes of his life, he's also losing 660 rupees. So it's like, how can you keep the 660 rupees and you also take the time away from? That is how bad smoking is. 20% of deaths. It's not a small number. Huh? 1 in every 5 deaths is due to smoking. 90%, 90% of lung cancers are due to smoke. Right? So why do people smoke? So now if you know, now, even if you take the cigarette packet, they will show very, very disturbing image. Right? They go with these cancers found on the face, in the teeth, in the mouth. They show all of that images. These fellows buy the cigarette. Smoking is injurious to health. Right? So even after seeing all of that. So why do they do that? Even if you know that you're walking towards your death, even though you're walking towards your death, you still take a cigarette and smoke. Why is that? So obviously, if you take anything in life, there has to be a benefit, there has to be a consequence. So if they are doing something, there should be a benefit. Or nobody will do anything. If there's a benefit only, they will do. This benefit mainly comes due to the compound called nicotine. Right? Mainly comes to this compound called nicotine. So now how does nicotine work? This nicotine is found inside the cigarette smoke. So as you are inhaling the cigarette smoke, this nicotine can quickly diffuse across the alveoli and go all the way into your brain. It can go all the way into your brain. So once this nicotine is found inside the brain, once this nicotine goes inside the brain, it is capable of stimulating certain nerves. I'm not going to go in much details. It can stimulate certain nerves to release dopamine. I'm sure you all must have heard of this dopamine a lot, right? Dopamine. Not only does it stimulate dopamine, it also stimulates certain mood boosters like serotonin. Right? Serotonin. Now, these neurotransmitters, these are called neurotransmitters, chemicals in your brain that give rise to an effect. Okay, so these neurotransmitters are associated with mood, happiness, leisure, motivation, right? So now what happens as you take in nicotine, it can give you a dopamine spike and increasing dopamine levels to put in layman terms. Okay, it will give you a dopamine boost. So once you get a dopamine boost, you feel better, you feel calm, you feel like you have accomplished something, you feel motivated to do everything. Not only does nicotine do that, nicotine is also capable of stimulating the sympathetic nervous system. Sympathetic nervous system, right? Sympathetic nervous system is involved in what? Fight, flight system. It will keep you more alert. Not only that, nicotine is also capable. Now, due to this sympathetic nervous system, it can increase your heart rate. It can increase your blood pressure. All of this can happen. Nicotine is such a wonderful substance. So if it's giving you this many benefits, it must be good, no? That's where we are on. All of this is temporary. You have temporary benefits for permanent consequence. You get temporary benefit. I think this effect lasts for maybe 1 hour. These effects may last for 1 hour. But the bad effects of nicotine. Now, if you are a chronic smoker, if you keep smoking, right, you need to remember there is nothing that is better than the first high. They say that. So now if you take a certain drug, they say heroin or cocaine, the first time you do that, you will feel a certain bliss you will never feel again. So now if you take cocaine for the first time, you will feel like all of these neurotransmitters are in overdrive. It will make you feel very, very pleasurable, happy, motivated, everything. But the second time you do it, it will be lower. Third time you do it, it will be lower. Fourth time you do it, it will be lower. Now, why? Because you're getting used to the feeling. So you will never reach the best high. That is usually the first time you ever did. The first time, the level of happiness you reach during the first time will never be reached. But the consequences will continuously be consistent. Right? So now, once we learned about this nicotine, how it can cause dopamine secretion, how it can cause sympathetic activation, increased heart rate, increased blood pressure, all of this will increase the alertness, right? But all of this is also temporary. So the benefits are very temporary. And then the benefits worsen with time because once you are getting used to smoking, these benefits are not there anymore. So now let's talk about the consequences. So inside the cigarette smoke, you have close to 7,000 chemicals. 7,000 chemicals inside cigarette smoke. Out of that 7,000, around 70 are carcinogens. Carcinogens. What is a carcinogen? Like I mentioned before, 90% of lung cancers are due to cigarette smoke. That is due to this. Around 70 chemicals out of the 7,000 chemicals you find in the cigarette smoke are carcinogenic. So now what does carcinogenic mean? It means it can give rise to cancer. It can give rise to cancer. So now these carcinogens are capable of damaging the cells that you find inside your alveoli capillary membrane, in the bronchi, in the bronchioles. It can damage these cells. So not only can it damage these cells, it will go further and damage the DNA. Once it damages the DNA, these cells can have uncontrolled mitotic division. Do you all remember that from cell division? Yes. So then that cell will multiply without a limit. As it is multiplying without a limit, it will give rise to a mass of abnormal cells called a tumor. Okay, or a cancer. Then these cells will not stay in one place. They will break off, travel through the lymph, blood vessels, and go to different organs in your body. What is that process called? Metastasis. This metastasis can take place and eventually kill the person by lung cancer. And it is not an easy death cause. You will suffer, struggle, and go. Right? So out of the 7,000 chemicals, 70 of them are carcinogenic. But then, not only that, the cigarette smoke itself is capable of the cigarette smoke itself is capable of doing something else, right? It can inhibit the action of cilia, stimulate mucus production. Inhibit the action of cilia and stimulate mucus production. Now, what does this do? So, if you take your respiratory epithelium, if you remember, your respiratory epithelium, right? Your respiratory epithelium. Over here, you know the epithelium is made up of what? Pseudostratified what? Columnar epithelium. And what do they have? Cilium. There are certain cells in near this epithelium known as goblet cells. These goblet cells secrete mucus. So then this cigarette smoke is capable of stimulating these cells to produce mucus. Okay, no problem. Mucus is good, no? Mucus only traps the particles and then this mucus is moved up by the mucus escalator and the pathogens will be sent out either into the esophagus or you can spit it out, right? Now, not only does it stimulate excess mucus production. Now, mucus production is good, but excess is always bad. Excess of anything is bad. Excess of anything is bad except for studying, right? So then, increased mucus production. This increased mucus production can block the airways since there's so much mucus. Not only is it increasing the mucus production, it is also inhibiting the action of cilia. So now this cilia over here will move like this. As it is moving like that, this mucus will be sent up. And as the mucus is sent up, it will go into the esophagus. That is the process of mucus escalation. All the foreign particles, dust, everything accumulates inside this mucus and will be sent into the esophagus. Okay? Right. But if this cilia is not working, this mucus will be present in that exact same place. It will block these airways. Not only will it block these airways, since there are foreign bodies, bacteria, everything inside this mucus, it can also get infected, inflamed, can lead to a condition bronchitis. Can lead to a condition called bronchitis. That is the inflammation of the bronchi. So now, obviously, this is not bronchi, this is the bacteria, bronchi is here. So this process happens throughout. Okay, the increased mucus production happens throughout. Now, you learned about the effect of cigarette smoke, the smoke itself. Now, there is a certain compound relevant to our A-level syllabus that you need to know about. That is known as H3 hydrogen cyanide. Okay, HC. This compound also does the same. It can inhibit cilia. It doesn't say much about mucus production according to the resource book, but it can inhibit the action of cilia. So now imagine if these dust particles, if these pathogens, if these foreign bodies go from the trachea into the bronchi, bronchioles, and eventually into the alveoli. Once they are in the alveoli, are there any cilia there? No. So how are the foreign particles in the alveoli usually removed? By what? Usually the alveoli is removed by what? Alveolar macrophages or the phagocytes that are there. Okay, the alveolar macrophages. So now what happens when there are foreign particles over here? When there are foreign particles over here, these alveolar macrophages will come and engulf these particles. So then over there, a process undergoes where there is damage, and then the damage will be healed, and again there is damage, and then again there is healed. This will result in fibrosis. Fibrosis means excess fiber formation, right? So there are now in the healing process, you have an important cell known as fibroblasts. Fibroblasts are capable of secreting fibers. Okay, so then these fibers are continuously deposited in these damaged areas, resulting in fibrosis. Fibrosis will thicken the alveolar capillary membrane. If this area is thickened, can gases diffuse across? Now, what were the factors we learned for an efficient respiratory exchange surface? It has to be thin, wet, permeable, highly vascularized, and large surface area. Okay. So now, since there is fibrosis formed, it will become thick. So once it is thick, oxygen cannot diffuse across. Carbon dioxide cannot diffuse across. Then the efficient respiratory surface area will reduce. Is that clear? Okay, fine. Yeah. Yeah, it's recorded. Okay, right. Efficient respiratory surface area will reduce. Is that clear? Okay. So now, you all may have or may not have heard of these terms before. But surely there is a certain compound you all would have heard of. What is that? Carbon monoxide. Yes, you have heard of carbon monoxide, right? So what does carbon monoxide do? So up to this point, you all are clear? Could you increase your volume a little? Umayma, can you hear me now? So what does carbon monoxide do? So you know your red blood cell, right? Your red blood cell has hemoglobin. Hemoglobin has four subunits. Yes, right. So oxygen is bound to this hemoglobin and is transported throughout the body. Yes. Okay. So here usually oxygen is bound. Right. However, carbon monoxide has a higher affinity. Affinity means it likes to bind with this hemoglobin much more than oxygen. Close to 200 or 300 times. So it does not allow oxygen to bind. Even at small concentrations of carbon dioxide, it will come and bind to these hemoglobins. So carbon dioxide binding to one subunit of hemoglobin, that additionally will prevent any more oxygens binding. Okay, so carbon monoxide will bind. Okay, carbon monoxide will bind. So now what happens? Carbon monoxide does not bind reversibly. So oxygen, how does it bind? It binds to hemoglobin when the concentration of oxygen is high, and it is released from the hemoglobin when the concentration of oxygen is low. That is how now it can act as a respiratory treatment, take oxygen from a high place and give oxygen to a place where there is no oxygen. That is how it works. So it's reversible. However, carbon monoxide is irreversible. Irreversible. So if it is irreversible, is there any point of this hemoglobin anymore? What's the purpose of hemoglobin? To transport oxygen. So if it cannot carry any oxygen anymore, is there any worth to this hemoglobin? No. Then is there any worth to this RBC? You are losing out on your RBC due to this carbon monoxide binding. What is the lifespan of an RBC? 120 days. So for 120 days, there will be this carboxyhemoglobin in your blood. Why? Because it is not reversible. It will bind to this hemoglobin very tightly. Let's say this carbon monoxide does not bind to all. It binds to, let's say, 3. And the other subunit is bound to oxygen. This can also happen, no? This can also happen. However, carbon monoxide binding to the other subunits can increase the binding capability of oxygen to this subunit. It will hold to this oxygen very tightly and it won't let go. So now, even if oxygen is there in that subunit, it still has no value. Why? Because it cannot be released from the hemoglobin. Did you understand? Not only should hemoglobin bind, it should also be capable of releasing. But due to the presence of this carbon monoxide, this oxygen cannot be released. So if it cannot be released, is there any worth to this oxygen? So this RBC with this many problems will be in your circulation for 120 days if it is exposed to carbon monoxide. Okay, right. So your cigarette smoke has this carbon monoxide. It is capable of binding to all of these hemoglobin, capable of forming something known as the carboxyhemoglobin, which has It has very high affinity for carbon monoxide, does not allow oxygen to bind. And even if oxygen binds, it will not allow oxygen to be released. So then there is no point of that RBC. That useless RBC will be found for 120 days, right? But now imagine this. So RBC's lifespan is 120 days, right? So then this RBC will be removed after 120 days and new RBCs are formed continuously. So if you smoke, if you stop smoking for 120 days, this effect will be lost. That means the carbon monoxide, hemoglobin, the hemoglobin that is bound to carbon monoxide will be dead and new hemoglobin or new RBCs will be formed. If you have stopped smoking for 120 days, all the carbon monoxide that is found in your body can be removed. Why? Because the life cycle of a RBC is only 120 days. Is that clear? Okay. Right. So then, these are the bad effects of cigarette smoke. So the only good effect, that is also only for the first few times you smoke. And the only good effect is nicotine. Nicotine will increase your dopamine. And again, when you continuously increase your dopamine, like in the further times or in another time where you try to increase your dopamine by doing something good, the feel or the happiness or the pleasure that you get will not be satisfied. So that is why people always smoke, and if they are smoking, it's very difficult to stop. Okay, so smoking, that small benefit, you can't even call it a benefit if it's coming with this much consequences. You have nicotine, which can increase blood pressure, and then that can increase heart rate, and it can also cause heart disease. Our consultant in our hospital, when I went, we go for clinicals, told if a certain consultant, if another consultant ever asks you, what are the risk factors for a certain disease, just say smoking, alcohol. You're okay. Because smoking and alcohol will cause all the different diseases that are known to most of the diseases. Okay. So if he says, if somebody asks you for the risk factors, okay, risk factors of obesity, smoking, oh, you're correct. Risk factors of heart disease, smoking, you're correct. Risk factors for improper bone healing, smoking, oh, that's also correct. So smoking is the root of everything. Not only does it affect the smoker himself, imagine I'm in the AC room and I can't eat without smoking. I tell you. Not only me, you all will also get the consequence. You all won't get any benefit, only the consequence. Okay, right. So then these are the ill effects of smoking. So I should check whether I have missed anything. No, I have mentioned everything. So if you write this, you should be able to get marks in the exam. Okay, let me move on to the next topic.